Welcome to our video on bites, stings, plants, and everyday care. We'll cover a range of common emergencies from insect stings to dental issues, based on up-to-date first response guidelines. For bee and wasp stings, scrape the stinger out sideways. Avoid using tweezers, as they can squeeze more venom. Wash the area with soap and water, and apply a cold pack for 10 to 15 minutes to reduce pain and swelling. For fire ant and swarm stings, immediately brush the ants off with a gloved hand or cloth. Treat the sting sites with a cold pack and hydrocortisone, but do not pop the itchy, sterile pustules. Seek medical care for severe symptoms or stings on a child. To remove ticks, use fine-tipped tweezers to grip the head and pull straight up with steady pressure. Do not use folk remedies like burning or petroleum jelly, as they can cause the tick to regurgitate. Watch for symptoms of Lyme disease for about 30 days. For snake bites, immediately call 911 or get to a hospital for antivenom. Keep the victim still and the limb roughly at heart level. Mark the swelling's edge and time to track progression. Avoid cutting, sucking, or using ice or a tourniquet. Most spider bites are minor. Wash the area and apply a cold pack. Black widow and brown recluse bites require immediate medical care. If safe, capture the spider to help medical professionals identify the species and guide treatment. For jellyfish stings, get the person out of the water and keep them still. Rinse the affected area with vinegar or seawater for 30 seconds to disarm stinging cells, and then carefully lift off tentacles with tweezers. Soak in hot water, about 43 to 45 degrees Celsius, for pain relief. All animal and human bites are considered dirty wounds and require 5 or more minutes of hard washing with soap and running water. Control severe bleeding and dress the wound. Seek medical care for almost all bites, especially punctures or face bites, and report any strange-acting animals for rabies consideration. If exposed to poison ivy, oak, or sumac, wash the affected skin with soap and cool water within minutes to remove the urushiol oil. Decontaminate all affected clothing and tools. Use cool compresses and calamine lotion to calm the rash, and see a doctor for severe symptoms or involvement of the face or eyes. For a speck or grit in the eye, blink in clean water or saline flush. Never rub. For anything embedded, cover the eye and go to the emergency room. A chemical splash requires flushing for 20 minutes, nose side outward, then heading to the ER. For a knocked out tooth, pick it up only by the crown and rinse gently with milk or saline. The best option is to reseat the adult tooth and bite on gauze. Otherwise, transport it in milk and see a dentist within 30 to 60 minutes. For a toothache, warm saltwater rinse and floss can help, and use OTC pain relief, never aspirin on the gum. To comfort an earache, use a warm compress and OTC pain relief. An upright posture aids drainage. See a doctor if symptoms persist beyond 48 hours, or if there is fever or severe pain, especially in infants. Never insert cotton buds, oils, or candles into the ear. Some first aid advice has been corrected since 2003. Avoid inducing vomiting for poisoning. Irrigate wounds with clean running water, not hydrogen peroxide. Use a tourniquet for life-threatening limb bleeds. For choking, alternate 5 back blows and 5 abdominal thrusts. Rinse jellyfish stings with vinegar and hot water soak. For concussions, assess first. Then sleep is fine. Be prepared by stocking a modern first aid kit, including basics and items like a tourniquet and naloxone. Skip outdated items like ipecac or cut kits. Keep emergency numbers readily available. Consider a certified first aid course to build muscle memory and turn knowledge into practical skill. If you only remember 3 things: 1. Scrape, wash, and watch stings and bites for anaphylaxis. 2. Remember myths bite harder than snakes. Keep victims still and avoid traditional movie cures. 3. For little emergencies, apply the right answers. A tooth in milk, flushing an eye, and a straight tick pull are small moves that can save the day.